is Dr. Barbara Boylan. I work for Alliance Medical Clinic located in both Hillsburg and Windsor. And I'm very happy to be serving as the cardiologist for the facility. I've done formal training in cardiology and cardiovascular medicine.
When should we start screening for heart disease?
That is actually a really interesting and not 100% simple question. There are some authorities like the American College of Cardiology and American Heart Association, and even they don't 100% agree on when screening should begin. But it never hurts to start screening early. At the very least, men should be screened by the age of 35, women by about the age of 45. However, if you have a history of heart disease in your family, such as a heart attack or a stroke, or if you have a family history of very high levels of cholesterol, diabetes, there are definitely conditions that make it imperative to screen earlier. So my recommendation has been to start screening everybody around the age of 20, and then particularly focusing on those people in high risk groups. But even if you're not in the high risk group, there's no harm in getting a cholesterol at a relatively young age. The other thing is, if you have never had a cholesterol, your first encounter with a medical clinic would be the time to check that out. So when we talk about cardiovascular disease screening, we're usually talking about getting a cholesterol panel. There are other things you should think about, though, and that are much simpler, things that are sort of, I think most people know it, but not everybody observes it. Simple things like eating well, eating a healthy diet, getting lots of fresh fruits and vegetables. Sometimes we talk about either eating a plant-based diet or a fish and nut-based diet. Either of those is probably better for you than consuming a lot of meat. Checking your blood pressure. People can get blood pressure at very young ages. And when that occurs, it can be disastrous, because high levels of blood pressure that aren't detected can actually cause a great deal of damage before you even know you have the problem. And keeping your body weight under control, probably checking to ensure that you don't have diabetes. Diabetes, particularly what we call type 1 diabetes or juvenile onset diabetes, puts you at a very high risk for coronary disease. In fact, in medical circles, we call diabetes a coronary artery disease equivalent. So it's very important, especially if you have a family history, to be screened for diabetes. So in summary, by early to mid-20s, most people should be getting a fasting lipid panel, a blood pressure measurement, some sort of assessment for diabetes, and making sure that their body mass, a name we call body mass index, but basically making sure that your weight is proportional to your height and that you're not getting to a very high level of obesity. Obesity causes problems in and of itself, and can lead to high blood pressure, diabetes, abnormal lipids, or cholesterol. So all those things need to be taken into consideration.
And how do men and women differ with heart disease?
You may have noticed earlier I said that women should be screened by the latest at 45 and men about 35. The main difference is actually that men tend to have disease earlier in life. They also are at higher rates of disease in general. Women have the protective effect of estrogen in their bodies, and it tends to make the blood vessels more flexible, the platelets less sticky. It really is protective for women. So women who have normal age at menopause have some degree of protection due to the estrogen in their bodies. Men also have the testosterone, which has a slightly detrimental effect. But then as time progresses, men will have an earlier onset and will be a little higher risk. But once you get into the 50s and 60s, women will have almost the same rates of heart disease. Another caveat to note, I think it's become, we learned this quite a long 10 or 20 years ago now, but one thing to keep in mind is that women and men don't typically have the same symptoms. Classical angina, pain, pressure, tightness in your chest, this is kind of like the cardinal sign for a heart attack. But women may have different symptoms, such as feeling faint, getting weak, feeling short of breath, being nauseated. And what makes it worse is women tend to deny those symptoms. It sounds a little bit like I'm stereotyping, but it's actually a known fact that, as a rule, women will deny the symptoms and not seek medical attention. So we've made efforts to make women and the population in general realize that while you do have typical symptoms for a heart attack, they can be very different, particularly in women, also in diabetics, and oftentimes in older people.
And what are statins?
I have a lot of heated conversations with patients about statins because they are very powerful and beneficial medications, but they also have a bad reputation, and they do have the potential to produce side effects, particularly with skeletal muscles in your liver. So a lot of people have an inherent resistance to taking statins, and I certainly wouldn't want someone to be started on a statin if there weren't a good indication. But a statin is basically a medication that was designed to reduce cholesterol metabolism or cholesterol production at the liver. And I'm talking specifically about something called LDL, which is low density lipoprotein. This low density lipoprotein is what I call the lousy cholesterol, to help you remember, because it's the one that does the lion's share of the damage to your arteries and your blood vessels. So most of the efforts to reduce cholesterol were primarily talking about reducing LDL cholesterol. And so statins were designed to reduce the production of LDL by the liver. For various reasons, they can be detrimental to the liver, especially if you consume alcohol, large amounts of alcohol. But the lion's share of people do not develop liver disease or any specific problems. And we do have a host of different types of statins these days that are metabolized and absorbed differently. So if you do need a statin, as a rule, most people can tolerate them very well. Interestingly, statins don't just help by lowering cholesterol. There have been tons of studies that have shown that statins not only lower cholesterol, but they reduce risk of cardiovascular disease across the board, even for people with normal cholesterol. And this is probably related to some sort of anti-inflammatory or molecular effect that is being studied, and we're starting to get a handle on it. We don't completely understand it, but one could say if we put everybody on a statin, then we'd have far fewer strokes and heart attacks. And that's probably true, but you also have to weigh, what are the risks of the statin and what is your actual benefit from being on a statin. So there are very detailed algorithms about who should be on a statin, what are the indications, and what constitutes enough reason to be on a statin. Clearly, if you've had a heart attack or a stroke, you should be on a statin unless there's a very compelling reason not to be. If you have a very high LDL cholesterol, you should be on a statin. If you have diabetes, like I said earlier, diabetes is considered a coronary disease equivalent. So diabetics should be on a statin unless they have an extraordinarily low LDL level. And then there are other ways to ascertain who should be on a statin, such as risk factors. We know there are more and more accumulating risk factors. Traditionally, high blood pressure, diabetes, obesity, tobacco smoking, high levels of LDL cholesterol. Now we also realize that obstructive sleep apnea is a risk factor, which again ties in with the obesity in a large number of cases. So we have various scores where we can actually calculate someone's risk of having a heart attack within a 10-year period. Actually, not just a heart attack, but a stroke. So we have lifetime risk calculators, 10-year risk calculators, but you can use those if someone has not had a heart attack or stroke and you're trying to figure out, what is my risk? If you were to have the conversation with your doctor about whether or not to start a statin, make sure he or she has considered those risk factors in addition to whatever your LDL cholesterol levels are. But if you are in a high risk category, which usually translates into greater than 10 to 20% risk of a heart attack or a stroke in the next 10 years, then I would highly advise considering a statin medication.
And what can I do today for my heart health?
That kind of depends on who you are. If you're a basically healthy person, I would say get plenty of at least moderate activity. Don't smoke. Check your blood pressure. Hopefully you can control it with things like diet, avoidance of salt. But if you do have high blood pressure, you should be treated. I hesitate to even get into the nutrition arena because our nutritionist, Laura Stevers, will be giving her own talk on nutrition.